Hey guys, welcome to this week's podcast episode. And I've got a fantastic guest for the audience today, Dr. Tracy Gapin. He's a former retired urologist and now he's in the longevity space. And I love doctors that are going into this field and helping us prolong and enhance our performance and our lives. And I'm really happy to have him on. So, Tracy, welcome.
Oh, thanks, Chris. Glad to be here with you today. This is
Yeah,
fun.
Yeah, I really love that. I know I love this area of longevity. So talk about your story and background and
Yeah,
we'll dive right into it.
sure. Yeah, thanks. So as you mentioned, have a background in urology. I spent 23 years in urology in a very busy practice, high volume group here in Sarasota, Florida. And about halfway through my time there, I woke up one day and found that I was not in very good health or shape myself. I was about 30 pounds overweight,
Mm.
felt like crap, wasn't sleeping well, certainly wasn't eating well or working out or training or doing any of the things I was supposed to be doing. And went to see a concierge doc here in town for my first physical ever. This was at the age of 40.
Mm.
And it was a very eye-opening experience. Felt very vulnerable as I realized that I needed a lot of help. And what was eye-opening for me more than anything was the fact that he didn't have many answers for me other than just simply lose weight, exercise, eat some vegetables, and put you on a statin if your lipids don't get better. And I didn't know much at the time. As a urologist, my focus was prostate cancer, doing robotics, doing minimally invasive treatment and MRI-guided biopsies and all kinds of cutting-edge cool prostate work and robotics and vasectomies and men's health stuff, but I didn't really know anything about, like, longevity or optimization or weight loss, energy, hormones. And I was prescribing testosterone at that point for 15 years, and I realized that I didn't really honestly know what we were doing. And so I went back to school for selfish reasons for myself, and I learned about hormones. I learned about epigenetics, and learned how to actually read genetics and apply those to health. And learned about functional medicine. Learned a lot of regenerative stuff. Went to A4M and AMMG, and learned through seeds about peptides and IFM and Kalish Institute for functional medicine. And I put all this stuff together, and I'm like, holy cow! I found, first of all, my passion for medicine again, because I was really getting frustrated and disillusioned with urology and the bureaucracy, the BS that goes along with running a practice. And I was able to really turn my health around as well by finding what I needed to do for myself. And so I started sharing this stuff with my patients and realized that I was onto something here when I was much more interested in doing that than doing the urology work. And so I gradually over time was spending more and more time focused on precision medicine, longevity optimization, whatever you want to call it, that I realized that was my passion and my true purpose in life, really. And so I did what any sane doctor would do, and I just quit. I jumped off a cliff and I said, I'm leaving urology and I'm not looking back. And I canceled all my insurance contracts. I left my group. I gave them a 1-year notice, dropped all insurance plans. I'm on any insurance, Medicare or any other coverage policies. And I launched Gapin Institute 4 years ago, and we're exploding now and we're doing so well. And it's fun. And I love what I'm doing, and I have an amazing team around me, and we're growing so fast. And man, it's all about just following your heart and your passion and finding what you love to do. And I remember the days that I would go into the hospital, and it was every day. In urology, every night you're in the hospital for a stone or hematuria or catheters not draining, whatever. All the BS that would drive me crazy. And I walk in the hospital, I was a different person. I was an angry, bitter man. I hated to be there. I didn't want to be there. And I know it affected my relationship with my patients. I know it did, because I didn't want to be there. And now I freaking love what I do. It's just so fun.
Yeah, really, because I know a lot of doctors, Peter Attia and Peter Diamandis, and this area of longevity is really interesting because I'm listening to podcasts and they're like talking about diet, fitness, nutrition, and all of this, and it reminds me of very early days, getting enough sleep, drink enough water, and these are the obvious. So once you and the pioneers are actually like the science and supplements and the biometrics, it's going to be really interesting. Yes, and there's so many different tangents. So one thing is talking about is this dichotomy between the longevity, and there's this battle with the existing medical industrial complex with the insurance. They're like, this doesn't work, and then it's actually
Yeah.
working. So talk
Yeah.
about it.
Yeah, sure. I look back to our days in medical school, and this is very relevant to answer your question, I promise. And I think back to medical school, we're taught about pathophysiology and we do gross anatomy and the cadaver dissection, all that kind of stuff. But in reality, what we're really taught, if you go back and think about it, is we're taught find the diagnosis, and this is the drug to treat it. Just diagnosis, drug, maybe diagnosis, surgery, diagnosis, drug. And so we're taught all the different drugs to use. And now I wonder how much the pharmaceutical companies were involved, had to the influence when it comes to our training. And I'm very suspicious that there was a lot of money behind the scenes that we never knew was going on there, because that's how we were taught. And looking at our healthcare system today, how broken it is, and it's all about just treating diagnosis with drugs and the polypharmacy that we see every patient on. And I don't think it's malicious. I don't think it's from ill intent. I don't think doctors are getting kickback. I know they're not getting kickback from pharmaceutical companies because we can't anymore. But I think it's just simply that's how we're taught. And not long ago when I was in urology, it was like I had 6 minutes per patient. In my office, I would have 50, 55, 60 patients a day, and I had 6 minutes with each guy. Am I going to talk to him about nutrition and sleep and tracking sleep with wearable technology and blood sugar tracking and all kinds of cutting edge peptides? No, I'm going to talk about his prostate. I'm going to look at his PSA. I'm going to give him his Flomax or talk about scheduling a biopsy or look at his prostate MRI or whatever and move on, because that's all I had time for. And every other specialty can relate to this, how you get so siloed into your specialty and you only have this much time because insurance is only paying you enough that you got to make it up in volume. And the whole system is broken. It's entirely broken. Doctors are miserable. Patients aren't getting results. Prices keep going up and it's just getting worse. And I just think it's failing.
Yeah. Yeah, it's so moving on, which is this area you talk about, especially with urology, and you talk about the men's health is in crisis and what is a men's health crisis? What are the factors? And then
Yeah.
talk about testosterone levels.
Yeah. So one of the things that's not really talked about is the men's health crisis, I call it. And what I mean by that is studies have shown, there's 3 longitudinal studies. There's the male Massachusetts aging study here in the US, and there was a similar study in Sweden and Finland. You can look it up or reach out to me. I'll give you the references. All 3 of these were longitudinal studies, 20 to 30 years in duration, that simply followed levels. And what all 3 of them found, same exact findings, testosterone levels, specifically free testosterone, which is the testosterone we care about, is about 50%, it's technically 45% lower now than it was 20 years ago. And it's dropping by about 1% a year worldwide. So free testosterone is dropping about 1% a year, 50% lower than it was 20 years ago. Fertility is the same, about 50% lower than it was 20 years ago. And I believe it's from the same pathophysiology affecting the gonads and endocrine disruption to the testicles. So we see that obesity is on the rise. We see that over 3/4 of men are either overweight or obese. And recent studies have shown that for the first time in a long time, lifespan is decreasing. We're dying younger. And so I think it's very clear that what we're doing isn't working. I feel that the healthcare system is broken, as we talked about. And when it comes to men's health, which is really my passion and focus, how men are so lazy when it comes to health. Men wait till there's a problem, and if it ain't broke, don't fix it. When you talk about being proactive or preventive, or men don't care about stuff. They wait until it's too late. And so what I'm really focused on is shifting that paradigm and getting guys to pay more attention to it, to wake up and do the work, to talk about advanced diagnostics, to find what are those blind spots that are lurking just under the surface and address them before they become a problem.
Yeah. Yeah. We know because there's other physicians that are focused on women's health and female health and reproductive health. So the next question I have for you is how your program, you have a G1 program, and you mentioned is growing. Is it products, services, is it coaching? Talk about your approach and your models and helping patients.
Yeah, thank you. So what we do at Gapin Institute is, first of all, I run the team, but it's the team that makes it all work. And what I've recognized is that it's not just one thing. Guys are looking for that magic pill. Give me testosterone, give me the magic peptide. And the answer is not that simple. It involves first finding those blind spots. And Bob Harper, great story I'll share. He's the fitness trainer on that TV show, The Biggest Loser. And he looks like the epitome of good health. We all aspire to look like Bob Harper. He's teaching people how to lose weight and get in shape. A couple of years ago, at the age of 51, Bob Harper had a massive heart attack, almost killed it.
Mm-hmm.
His issue was massively elevated LP little a. Not a lab that's typically ever checked by primary care, not a lab that's even understood or known by most doctors in traditional healthcare. But for Bob Harper, it almost killed him.
Uh-huh.
Example of a guy who looked like he was in the best shape of his life. And everything we do, all of our programs start with advanced diagnostic testing. So this is blood lab panels, taking a deep dive into cardiovascular risk, things like Lp(a) and ApoB and Lp(PLA2 and other markers that are never checked when it comes to cardiovascular health. Complex hormones, not just TSH, looking at free T3, not just testosterone, but free testosterone, looking at DHEA. We look at nitric oxide and all these other hormones that most docs don't even know how to check or what the levels mean. We then take a deep dive. So by this, I mean looking at genetics. And we use genetics to understand things like what food should you eat? What food should you not eat? It's actually surprising to most people, but for some people, keto's not effective. For some people to lose weight, have better energy, they need more carbs, not less. And genetics can help us understand that. For some people, based on genetics, you don't want to be eating a lot of saturated fats. And so maybe carnivore or keto or anything where you're eating a lot of red meat may not be best for your genetics, and that may increase your risk of cardiovascular disease. Genetics can help us. Functional testing, looking at the gut. Geez, how many times were we taught in medical school or residency or training, Chris, about the microbiome? Never. But the microbiome controls everything. Our gut controls the entire body. It controls our metabolism, our hormones, our immune system. Everything is somewhat in some way affected by the microbiome. And so we test for that because it has such a big impact on things. I'll see guys who, one of my clients, he's a race car driver. No kidding. Race car driver comes in because he finds on the track, racetrack, he can't make decisions quickly enough, like brain fog. Something's off when it comes to making turns, and he's just slow to react to decisions. Come to find out that he had major gut issues, microbiome issues, and he had food sensitivities to bananas and coffee. Now, guess what Marco was eating for breakfast every morning? Bananas and coffee. We fixed his hormones, didn't really change anything. We cleaned up his gut a little bit, and it helped a little bit. But when we got rid of those two offending agents temporarily, he was like, a light switch went off.
Yeah.
Stuff like that you'll never find in traditional healthcare that makes all the difference in the world for these guys. We have a guy who, for the last year, he's been complaining of this dense fatigue, low energy. Come to find out, he has massive mold levels that were detected through GI testing and then organic acid testing, which helped us find mold, which was the source of his problem. You go to primary care, they're going to give him all kinds of antidepressants and tell him he just needs to sleep better and maybe give him testosterone or whatever, but that wasn't the answer. So it all starts with the advanced diagnostic testing, finding your blind spots and taking a deep dive. And that's where the magic happens, Chris, because that's where you can find what's right for you and what's right for the next guy. And everyone's different.
Yeah.
And I really believe one size fails all, and that what's right for one guy is wrong for the next. And I hate going on Twitter and Reddit and seeing all these people battling over the perfect diet or perfect supplement stack or this or that. It depends on your testing. So when we design a blueprint for someone that incorporates nutrition and sleep stack and fitness programming and hormones and peptides and supplements and you name it, it's all individually customized based on what that person needs, based on the diagnostic testing, because that's where it all starts.
Yeah.
And then the fourth step of my process is the data. So I'm a huge believer now in the magic of wearable technology data to track things like sleep. Oura Ring, for example, is great to track sleep quality. You can track heart rate variability, which is a marker for stress, a surrogate for stress that high performers say they don't have, but they do. We can track blood sugar with CGM blood sugar monitors, not just for diabetics anymore. We can track intake. We can track body composition, all these cool data points that help us understand if what we're doing is working or not. Again, traditional healthcare is just not doing any of that stuff. And I think that makes all the difference.
Yeah, it's interesting. It's really interesting because I was hearing like a blood test or these scans, imaging that can personalize and tailor some of the most advanced techniques to optimize your fitness and your nutrition and all of these that you were talking about. Health diagnostics, what are the most critical diagnostic tests that men should be taking regularly? How often should they be checked to stay on top of their health?
Yeah. Some of the labs that are not often checked for men, first of all, free testosterone. So often men will come in and they've never had it checked, or they've only had total testosterone checked. Very common for primary care to just check total. A caveat here, the reason I'm bringing this up is when you look at the lab slip, the right side of the page has a reference range, right? And everyone looks at that reference range. Even doctors look at the reference range. And if you're in that range, you're like, yeah, you're fine, you're normal, you're good, no problem. Which is bullshit. Excuse my language, it's bullshit because it's important that people understand what that reference range means. What is that range? So LabCorp will do 1 billion testosterone levels, let's just say, and they will simply look at the average of all those lab tests they did, and they'll look at the median statistical average and then 2 standard deviations above and below, and that's how they come up with that reference range. It is nothing more than the average of all the tests that they do, which when you're testing sodium or potassium levels or creatinine, that's fine. That's not changing. That's pretty stable for 100 years, 200 years. There's no issue there. But I just got finished sharing with you a few minutes ago how testosterone levels are dropping worldwide. Worldwide, not debatable, unequivocally, testosterone levels are half what they were 20 years ago. So therefore, if you think about that reference range now with that perspective, that reference range is literally half what it was 20 years ago. And so now when men are getting their levels checked, they're not even checking free, they're checking total. But even if they did check free, they're in the lower part of that range and they're being told they're okay, they're normal, they don't qualify for testosterone therapy, they don't need it, you're okay. Nonsense. And so this is a really important point for men. This talks about taking control of your health and not falling for this broken healthcare system that we're stuck with. You don't want to be at that low range. So I'll give you an example. I have a couple of NFL players we're working with right now, NFL receivers, active players. One of them, he came in and his free testosterone was 6. Should be 20. Should be around 20. 15 may be okay. 25 for some men is ideal. Should be around 20. His was 6. We see this in the guys walking off the street, very low levels. But if you look at the range, they're being told, no, you're normal, you're fine, you're in the reference range, you don't qualify for treatment. Very common problem. So free testosterone is a big one for men. Free T3, thyroid hormone, is one that I would recommend most men get checked as well. Thyroid is an underappreciated hormone for men. It's not just for women. It's important because it affects energy systems, metabolism, weight loss, mood, etc. It also helps with gut health, and gut affects thyroid. They go yin and yang, so to speak. DHEA sulfate is another key hormone for men. It's a precursor to testosterone, but it has its own important functions as well, especially mood, energy, metabolism, counteracts cortisol. I like checking cortisol levels in men. This is something that is a saliva test, not a serum test. So typically we'll do 4-spot saliva cortisol tests throughout the day. Mentioned microbiome testing. I think that's important. Cardiovascular testing, I mentioned. We know that without question that cardiovascular health, cardiovascular disease is the #1 cause of death in men and women still. And so we need to be really aggressive with cardiovascular screening. And so looking at ApoB, which is probably the best marker for cardiovascular risk, because every non-HDL particle, every atherogenic particle has one ApoB. It's the perfect marker to assess your cardiovascular risk when it comes to lipids specifically. So rather than LDL cholesterol, check ApoB. Check Lp(a), which is the one I mentioned earlier that Bob Harper had. Look at things like homocysteine. They never teach you this in medical school, but methylation is a very important process that happens in every part of our body. And you can assess that based on homocysteine levels. And sometimes just diet can correct that. Sometimes B12, folate, B complex support can help with that, but that's a key one to check as well. Looking at markers of inflammation, looking at food sensitivity testing I mentioned earlier, looking at the microbiome in parallel with that. All of these tests give you this picture to understand the human as a whole that any one test is missing. And you look at most lab panels that primary care is doing, and they're just barely scratching the surface, honestly.
Yeah, I love that. It's amazing just how much, if you applied just the modern science and research into it, how much improvements. I know the other question I have is that there's this, every time I leave the United States for an extended period, I feel like the food quality is better. Here in the United States, there's a food poisoning and there's obesity, and just like you see people on medications just everywhere, and there's, so what, nutrition wise, how should we be thinking? I know it's like the fruits, vegetables, but I'm just curious to hear your thoughts.
Yeah, great question. I think that it can be very simple by just thinking about eating real food. Eating real food means we're not eating from packages. We're not eating processed stuff. You look at the ingredients, you don't recognize it, you can't eat it. And when you start doing that, yeah, it gets down to you're going to be eating whole, fresh fruits organic fruits, organic vegetables. You're going to be eating lean meats. Even occasional red meat is fine for most people. Testing can help us identify those who maybe you need to limit it. Wild caught fish, organic meats, grass-fed beef, wild caught salmon, fresh foods, not in a package is really the focus. I think one of the most insidious dangers that's right under our nose are the omega-6 polyunsaturated fats, the seed oils, people call them, that are very pro-inflammatory. Without question, you look at the rise of cardiovascular disease since the 1950s, very clearly parallels, identical correlation between the increased use of these seed oils and cardiovascular disease. We're talking about the canola, the sunflower, the cottonseed, the peanut, all these seed oils that are typically used at restaurants. And so one of the ways people talk about eating healthy is just simply cook your own food because you know what's in it. Focus on using avocado oil or olive oil. These are great healthy fats that are good for you. You need fat. It's not that you shouldn't be low fat is not necessarily the case. It's what kind of fats. And that's where limiting the omega-6s. Saturated fat should be a small portion of your diet still. I think that a balanced meal is important. I think macronutrients is something that people can handle. And what I mean by macronutrients for the listener is simply proteins, carbs, and fats. And they don't talk to you about this at all in medical school, obviously. But the balance, the ratio of those matters. And they affect our metabolism, our energy. And it's important to understand that protein is key. And how much protein should I eat? People think that proteins are toxic to the kidneys and limit proteins. It's actually a false narrative. And there's very little data that shows that protein is going to have real damage on the kidneys unless you're in chronic renal insufficiency, unless you're in kidney failure. It's just not a factor. So what most people need to focus on is 1 gram of protein per pound of body weight. And so for men, that's 160 grams of protein a day. Now, the range is 0.8 to 1. So if you're 160 pounds, that would be about 148 to 160 grams of protein a day. And when you do that, what happens miraculously is you eat a lot less carbs and a lot less fat because you're focused on the protein. And that starts to get things in range. By doing nothing other than eating real foods, focusing on protein, again, 0.8 to 1 gram of protein per pound of body weight, that's going to make a massive difference. The third thing is people just need to drink more water as well. Dehydration is one of the most common causes of low energy. And when you drink more water, you tend to eat less food as well.
Yeah, I love that. How can people find out more about you? You got all the credentials, and just if they want to learn more, they want to improve their health, all of that.
So website is gapininstitute.com, and I'll direct everyone to gapininstitute.com. That's GAIN institute.com /launch. And I'm going to direct people there because I have a bunch of freebies on that site, on that page. Everything on there is free. I have a masterclass that I've created. I have a copy of my TED Talk I gave last year on the men's health crisis. I have a digital copy of my Male 2.0 book. I have a peptide guide that goes through all the latest cutting edge peptides. I go through a high performance health handbook that goes through 15 strategies that you can start to leverage today to have more energy, have better sex, and live longer. And again, all those are free for anyone who wants them. And then there's also a link if you want to learn more about how we can help anyone. There's a link on there to book some time with my team as well, all free.
Awesome. Yeah, really interesting. And I know a lot of the audience listening are doctors and would be interested. And so for all be sure to check out Tracy's resources and give his socials a like and follow. And thanks so much.
Thank you.